Hello everyone, I'm Dr. Skerdi Faria, founder of Keit Hospital. Today I want to talk about a phenomenon that is being seen more and more frequently in aesthetic medicine and surgery. The moment when the face created on the screen through filters and digital processing starts to be considered a standard, while the real face starts to be perceived as insufficient. This phenomenon does not constitute a diagnosis in itself, but represents a pattern that in recent years has manifested itself with particular clarity. The person doesn't necessarily come in with an excessive request. Often they present a request that seems simple. I'd like to improve my nose a bit, I'd like fuller lips, I'd like clearer skin, I'd like to look fresher. However, looking closely at the expectations, one understands that the point of comparison is no longer a person's real face, but an image constructed on the screen. Digital filters don't just soften the skin, they change facial proportions, smooth the texture until pores disappear, unify colors and shadows, reduce the nose, accentuate cheekbones, increase lip volume, define the jawline, and create a clean, often unnatural symmetry. This image appears orderly, controlled, perfect, but it's an image devoid of biological limits. It lacks real expressiveness, it has no natural movements, and it's not subject to real light, real time, and the daily variations of the face. The more a person sees themselves in the processed version, the more that version is perceived as normal. Progressively, the real face begins to appear more irregular, more tired, less symmetrical, less orderly. At this point, it's not the face that has changed, it's the expectation that has changed. The standard of comparison has shifted, often without the person even realizing it. This process generally begins before any treatment. The person arrives with an idea formed by photos, videos, and the reflection of themselves in the camera. Often, they're not aware of the fact that their request is linked to a processed image. During the consultation, they may ask for a small change, but the real expectation is for the face to take on the regularity of the screen. This is where the first problem arises, because the request isn't based on real anatomy and natural harmony, but on an artificially constructed image. Then follows the face after the treatment. Even when the result is good and carefully executed, the person goes back to filters, looks at themselves in the camera, compares themselves with the edited version, and feels that something is missing. This generates a particular dissatisfaction, not because the treatment is inadequate, but because the comparison is wrong. Instead of measuring against reality, the result is evaluated against an image that does not exist outside of the screen. And when this happens, the request for further intervention becomes inevitable because the standard continues to shift. In aesthetic medicine and surgery, it is necessary to clearly state that medical results cannot coincide with digital ones. We work on living tissues that have elasticity, limits, healing times, movement, and expressiveness. We must preserve naturalness because the face is not just appearance, it is communication, it is voice, it is mimicry, the way a person expresses themselves when they laugh, when they speak, when they show emotions. The filter, on the contrary, produces a static, uniform, and controlled image that does not respect the laws of the body. When this phenomenon is not recognized in time in aesthetic medicine and surgery, the risk increases. The person can enter a cycle of successive requests, a little more symmetry, a little more lifting, a little more perfection. In this phase, even when the results are objectively good, satisfaction is brief. Not because the face does not appear pleasant, but because the expectation is built on a model that is not real. This increases frustration, increases the emotional burden, and makes the journey increasingly burdensome. Here, the doctor's responsibility becomes decisive. In aesthetic medicine and surgery, the ability to intervene does not coincide with the obligation to intervene. There are situations in which the most correct choice is to slow down, stop, or postpone the treatment. This happens when the goal is based on an edited photograph, when the request is, I want to look like I do with the filter, when the person no longer has a clear goal, but only an indistinct feeling of dissatisfaction, or when, after every good result, the request for a further change is immediately born. The regulation of expectations is the most important part of this topic and must be addressed both before and after each treatment. Before treatment, it is necessary to establish a real reference. How does the face appear in natural light? How does it move during a conversation? How is overall harmony maintained, and what are the natural limits not to be exceeded? After the treatment, it is necessary to restore a correct evaluation. I don't look like the filter, but I look fresher, I keep my natural look, I feel better about myself, and there's harmony. In some cases, the healthiest choice is to do nothing. A phase without filters, a break from comparisons, and a return to focusing on the real face can be more useful than any further intervention. Because if the standard is distorted, even the most accurate result will seem insufficient. In conclusion, this phenomenon reminds us of a simple truth. The screen creates images while the body has life. Aesthetic medicine and surgery can improve features, but they cannot and must not chase an image that belongs only to digital processing technology. A responsible approach requires clarity, realistic limits, and the willingness to slow down when expectations are no longer anchored in reality. The doctor's role is not to follow a model created by a filter, but to protect the individual's well-being in the long term. Thank you for listening.